I am Catherine Arthur Hirschenfang, here for the GPHS podcast with Dr. Daniel Harper. Dan has a background working in US federal agencies, among them the Centers for Disease Control and Prevention, CDC. Dan has also worked as a professor and has a very strong background with universities. Dan previously was captain with the Vessel Sanitation Program, VSP. He is a credentialed environmental health specialist and registered hazardous substance professional. Dan has written publications and articles, manuals, and many more for corporate groups, industry, and universities. So Dan, thanks for joining us.
Thank you, Catherine. It's a pleasure to be here.
It's great to see you. But Dan, you have a unique experience having worked with the VSP on 3 separate time periods, right? That's what I think the record shows. True. And you are among a small group of people in the world, and I mean in the world, being one of the originals, one of the pioneers of the VSP. So why don't we start there? Tell us your story and how you began working in public health and particularly with cruise lines.
Well, it is kind of an interesting story. I started working with the United States Public Health Service as an ensign. That we have Navy rankings, and so I was an ensign. I was working on Indian reservations, which the Public Health Service has a large role that they play on Indian reservations for public health. And I ended up getting transferred to the Vessel Sanitation Program in Miami. And of course, the Vessel Sanitation Program was under the quarantine service at that time. And Mr. John Yashik was a commander at that time, and he was my supervisor. And it's interesting that at that time, very few ships were coming to the U.S. compared to today. At that time, about 43 or to 47 ships were actually coming to the U.S. on a routine basis. And there was only myself and Mr. Yashik. He had been by himself. He had done some basic training, on-the-job training for some quarantine inspectors, but the quarantine inspectors did not really have the academic background to do public health inspections, food and water and so on. So Mr. Yashik, who had a master's degree in public health, was a very good environmental health person, trained them with on-the-job training at the different ports to do basic public health inspections.
Were they known as inspectors, Dan, when they went on the early group? Were they known as inspectors at that time?
Well, that's interesting because quarantine throughout the world actually has a role, and their role is to prevent contagious disease from coming in to the country, whatever country that might be, England or Australia or the United States. And so the role of the then quarantine officers, they were called, was to go on ships, and also they were at airports throughout the country, and they were looking at shot records. At that time, people had to not only have a passport to travel internationally, but they had to have shot records. And some people may remember they were a yellow little booklet that had all your vaccinations in it. We may be going that way again, by the way.
Right.
But in any case, the quarantine inspectors had to check people to make sure that they were not, first of all, that they were vaccinated, and then of course they also looked for some basic signs of contagion in the population. So they also, the airports were a large part of that, but of course ships, and there were a lot of transatlantic ships and back in the 60s and that, but they were going and they were getting on ships, and their role there was really, again, look at medical records and make sure that people were properly vaccinated and did not have contagious diseases coming into our country. And that was the role until the beginning of the VSP program.
What year are we looking at there, Dan? About what's the timeline there? Late 70s?
Well, well, I'll tell you the story of the VSP program and how it got started, and the way that it was related to me by Mr. Yashik and others that were of that era. And so the quarantine officers used to get on the ships, look at medical records and so on. And then, of course, the ship would be released. If they had an outbreak, they would have to run up a yellow quarantine flag, and of course, all kinds of quarantine laws that would come into effect. Well, in the somewhere in the, I believe it was 1973 or 74, a ship came into the United States. It came into New York City and was inspected by quarantine inspectors. And again, they were looking at medical records and doctor's office and so on, not food and water. That was not part of their purview.
Interesting.
And it just happened that they missed something. There was an outbreak of Salmonella typhi, which is typhoid fever, on that ship. And they let the ship sail without quarantining it. And the ship sailed to Canada. When it got to Canada, the outbreak had increased. And when the Canadian officials got on the ship to do the same kind of quarantine review as had been done in the United States, they found a full-blown outbreak of typhoid fever on the ship. Well, the Canadian government lodged a complaint with the State Department of the United States and said, why are you allowing ships that have obviously real contagion to come to our shores without any notification? So Congress got very excited, and they asked CDC, what are you doing, and why are you not, doing this better? And so at that time, it looked that the Salmonella typhi was probably food or water. And so they started looking at their program and said, well, our people are not qualified technically to look at that. And so they brought Mr. Yashik, John Yashik, in, right, Commander Yashik, from another part of the quarantine service, brought him into Miami and asked him to set up a program by which they would look much more deeply into cruise ships, not just at the shot records and the medical records, but also look at food and water, recreational water, and so on. So Mr. Yashik took on that task, and it was a huge task. Even though there weren't all that many ships at the time, still there were a lot of ships sailing out of Miami and other places, and he had to devise a program. He did that by using the then current, which I believe that was the 1970 FDA food code. He used that. He used the World Health Organization's guide to water on ships and some other various references, and just put together a program to start to evaluate ships on food and water, recreational water, and put together a score sheet, actually, within the
And it was
next few
called?
years. And so with 100 points available, and they started the CDC always produced the monthly or the weekly morbidity mortality report, the MMWR, and they started putting forth also this green sheet. The green sheet gave the scores of the cruise ships, and the score, of course, was 0 to 100. And at that time, many of the ships could not pass the inspection. And so then in 1979, I was hired. I was the second commissioned officer. As I said, I was an ensign, and I came in to work with John Yashik and to do these inspections. And and we still had some of the quarantine people who were trained on the job training to help out, but John and I were were the leads on all the inspections.
What were some of the cruise lines that participated in the program back then? We know Carnival was always a leader.
Yes, well, of course, Carnival came in after the Norwegian, several Norwegian companies were doing cruising. There was Royal Caribbean, there was the NCL or Norwegian Caribbean Line, there was the Viking, Royal Viking cruise line, and Carnival came in, I think, probably in the early 70s, but those were the main companies that were coming in. Even, of course, some of the English or British companies were coming in, but they were not sailing routinely. The ships sailing routinely were typically Royal Caribbean, Norwegian Caribbean Line, and Carnival. And then there's a German line. I forget the name of them, but there was some different companies like that were sailing out of Miami mainly. A lot of them were going to Puerto Rico, New York, and so
on. And many of those companies are still in business today, which leads me to the idea of that public health depends on honest collaboration with authorities, right? Particularly as they restart operations today